This is Lori Sonken with WRFI Radio News. My guest is Joe Sammons. He's the Chief Executive Officer of Planned Parenthood of the Southern Finger Lakes. We're standing in the new Planned Parenthood building in Ithaca. The address is 620 West Seneca Street. Everyone's very excited about the new building. Joe, can you tell me some of the special features?
Yeah, this health center is almost double the size of our old health center, with a waiting room that is spacious and private. And every exam room, every clinical space that we have offers a great deal of privacy, as well as plenty of room to get the quality, compassionate care that you've come to expect from Planned Parenthood.
That's wonderful. I noticed that the parking lot, it's a little bit different than your last building. Can you talk about that a little bit and why you changed the drawings?
Sure. In the old building, we only had a limited parking for clinical staff. And this health center has a fairly ample parking lot with plenty of space for patients to come in and access our building from our parking lot and the gardens that surround it. And we did this for two reasons. One, as a convenience to the patients, but also when we do get protesters and they stand there outside of the old building, patients had no choice but to go through or past those protesters to get in. And that's not the kind of respectful private care that we think patients deserve.
Oh, that's very nice. In case someone doesn't know, what are some of the types of services that Planned Parenthood provides?
Well, 94% of the healthcare services that we offer are preventive health services designed to keep women healthy, to reduce unintended pregnancy, and to serve women and men as they go through all of the life stages of their sexual health and their reproductive health. So breast cancer screenings, cervical cancer screenings, tests for STI and HIV, wellness visits. Obviously, birth control and family planning is a big part of what we do. We also offer 6% of our services are abortion services, so that if a woman finds herself in this position where she has to make a decision about a pregnancy, she doesn't need a lecture or a debate. She needs healthcare, compassionate healthcare, which we provide. But all of the other services we offer are designed, frankly, to keep women from being in that position in the first place.
I understand that you even offer some services for transgenders.
We do. So we're the only Planned Parenthood currently in New York State that will offer clinical services for those going through, transgender health services like hormonal replacement therapy and other services. So it's a practice that's growing, and we get a lot of folks from outside Ithaca to get the kind of care that we are, the specialized care that they deserve.
What about men? I mean, people think of Planned Parenthood, they generally think of women, but I understand that there are services you provide for men as well.
Sure. The fastest growing population we serve, in fact, are men, and they coming in for STI tests and HIV tests. They are coming in for wellness visits. And, there is just a lot of growing sense that men are a part of relationships and decisions that are made about families. And Planned Parenthood wants to make sure that men are as healthy as women are and are as informed about the decisions they're making.
And what does it cost to visit Planned Parenthood? For example, what happens if I don't have any health insurance?
A lot of people are on these plans that have high deductibles and these kinds of health care plans. Planned Parenthood wants to get you the care you deserve first. And then if depending on your income, we can slide the fees that are, so it's a very affordable place to get care. And the bottom line is that no one gets turned away based on their ability to pay at Planned Parenthood. So we encourage everybody to come in and get health care.
What about confidentiality? How does that work?
Well, all of our services are extremely confidential, and what we ask basically is, how do you want us to contact you? Do you want us to say that we're from Planned Parenthood if we're calling? We take patients' privacy with the utmost concern, and every woman, every man who comes in here can know that their health care is safe with us.
And how does Planned Parenthood work to prevent abortions?
Well, there's really two ways. One is by, as I said before, when women come in for health care, that makes sure they have a reliable birth control method, that they have the right information about what will work for their bodies and their lives. That's a really good head start. But we also believe that a lot of decisions aren't made in the health centers. They're made out in the community. They're out in the schools. And so we have a community-based education program that talks to almost as many young people and their parents outside the health centers as we do inside. And we run the largest sex education program in this area. And that's a really important way to, make sure that women and men make the right decisions for them.
How many visitors do you get a year?
Well, we have 22,000 visits in our health centers.
Wow.
And we serve about 12,000 or so clients out in the community education programs. So it's a large number of people that we touch and try to make sure that they make informed, healthy decisions about their bodies.
How is the numbers? How have they changed? I know that you told me like a long time ago they were much fewer. How have you grown?
In Ithaca here, the main reason we built this health center, and that we've been trying to build it for so long, is that when we moved into our building over at State Street in 1980, we saw 3,000 visits a year. Today, this same health center serves 12,500 visits a year.
Wow.
And we have 4 other health centers all throughout the other parts of our region, one in Watkins Glen, in Corning, Hornell, and Elmira, that also see thousands of women and men every year.
What did it cost to build this facility?
This facility cost us around $5 million to build, just for the construction cost. It's more when you count all the architect fees and all the other things. That's why we're having a community-wide capital campaign called A Time to Build. And not just to build this health center, but we've already built a new center in Hornell and opened the doors a few years ago. And starting next spring, we'll be opening the doors on our new health center in Corning, New York, the home of Margaret Sanger. So we're having a regional Time to Build capital campaign to try to raise $6.35 million.
You mentioned Margaret Sanger. Some people might not know who she was. Can you give us some background?
Happy to. Margaret Sanger was a woman who was born and raised in Corning, New York. And she really started Planned Parenthood, and she started the movement for reproductive freedom for women. She believed that a woman could not call herself free who didn't control her own fertility and her own reproductive health. And so at a time when it was illegal just to even talk about birth control, much less have access to the pill or any other sexual health services, Margaret Sanger was a pioneer who stood up for women and created the organization that we now know as Planned Parenthood.
Many of our listeners are from Watkins Glen. Mm-hmm. Can you tell me about some of the services you provide in Watkins Glen? You have an office there, is that correct?
We do. We have a health center in Watkins Glen, which is open. It's once every other Thursday. We have a health center there with a nurse practitioner and a nurse to take care of patients. We also have a call service. We run the sexual assault resource center up in Schuyler County. So we have services there for women as well who are in crisis. And, it's a community that we have been in for more than 40 years, and we're proud to be there.
Getting back to what it cost to build the building, I believe you told me that where do the contributions come from?
Oh, they're all coming from residents and supporters locally here in the 4 counties that we serve. Obviously, a large portion of them are coming from Tompkins County, but we've also raised funds from folks in Chemung and Steuben and Schuyler counties. And we did get one small state grant from Senator Barbara Lifton early on, but the vast majority of the $5.7 million we've already raised comes from donors large and small right here in this area.
Wow. We're just about out of time. I'm wondering if there are any other points that you would like to make. And also, I think it's important to talk about some of the community services that you're planning to hold here. I know there's a huge space upstairs. You just showed it to me.
Yeah. We have a community conference room here on the second floor that can fit 55 to 60 people. We have an incredible youth space for education activities and parent groups and mother-daughter retreats, that kind of thing. And we're really hoping the community will come and check it out and realize that Planned Parenthood is here for them. Across the country, we have seen state after state pass laws that restrict access to abortion, that restrict access to birth control, and allow employers to deny women coverage for birth control that 98% of women use. So creating this health center right now is our region standing up and saying, not here, not now. We believe that women's health and men's sexual health is a priority, and we should make sure that women have access to these services for years to come.
Joe, could you tell me the hours that you're open and what days of the week in case people want to come visit?
Well, we're here Monday through Saturday. On Saturdays, we're open from 9 a.m. till noon, but all the other days of the week, the doors open as early as 8:30 and close as late as 9, depending on the day of the week. So if you'd call our health center at 607-273-1513, you'll be able to get through to a person who can tell you what the hours are on that day.
Can you repeat that number one more time, please?
It's 607-273-1513.
And also, do you have a website?
We do. Just go to www.ppsfl.org.
I've been talking with Joe Sammons. He is Chief Executive Officer of Planned Parenthood of the Southern Finger Lakes.